What's the difference between the medical model and the nursing model? Well, that's a great question. I would love to tell you the answer. So the medical model and the way that care is provided to patients from the medical perspective. So this term, medical model, really kind of got coined in about the 1970s. It is cause and effect. Cause meaning this is the pathophysiology of whatever's going on, and this is the effect, the signs and symptoms, okay? They're having this issue, and this is what I would expect to see with those issues. How do we address that specific problem? It's also been considered disease-focused, so we're focusing on the problem and addressing that. And that's kind of the medical model way of the way doctors, medical, meaning like the medical team, physician assistants, and physicians, how their education is really structured. Juxtapose that to the nursing model. The nursing model is more so holistic care, like considering the whole aspect of the person. So it's not just this is the disease and the problem, but we're also considering social factors, support systems, and how those things can influence what's going on and also influence the best way to take care of a patient, considering those perspectives as well. And the nursing model was coined also around the 70s by Dr. Jean Watson. She is a nursing theorist. If you are a nurse, you've probably heard of her. Very famous, and had, I think it was called the 10 curative factors that this was based upon. And it considers their family, their support system, their social aspects, and everything that can really influence how a person responds to a disease or a situation, and how that can impact their recovery. So it's a more holistic way of caring for someone. It also, and so you'll notice nurse practitioners are kind of educated with that nursing model mind, which is different than the physician assistant medical model mind, but they both at the end of the day end up having a similar scope of practice, but a different way that it is that they're educated about it, if that makes sense. So I hope that helps make sense between the medical and nursing model. Make sure you subscribe, and I also have a newsletter where I send out weekly tips and tricks for nurses, and the link to sign up for that is in the description of this video. Thanks, nurses.